This is not for kids.
So she's saying, I never would have used the same needle on a patient.
Or not given them their medication.
Right.
I wonder if that's true.
That's not true.
I wonder in her case if that was like, did she actually...
Yeah, because she gave people hepatitis C.
Or did she?
Couldn't be traced back to her.
Maybe she had Hep C, and maybe they had a different Hep C that they got from the hospital, and the hospital would like to pin it on her. But there's more.
For over 20 years, nurses have been rated the most trusted profession. But nurses are terrible people too. Join us for a discussion about nurse crimes hosted by nurses.
Welcome. This is Nurse Dorothea.
This is Nurse Ratchet.
And I'm Walt.
And together, we have 70 years of nursing experience.
You heard that right. 70.
Mew, 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 mew.
Our nursing career together is already retired and living their good life. Have a vegetable garden in the backyard.
And chickens.
And chickens.
Sounds good. Today, we are going to talk about Cora Weberg. Do you think it's Weberg? W-E-B-E-R-G? Weberg?
Weberg.
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 Yes. I'm sure that's how she pronounced it.
So Cora Weberg. Cora, I did not find any information on Cora's early life, but we found information on Cora's crime.
Criming.
She was the nurse from Washington, right?
Yeah, she's from Washington. Public health. It's so important. You don't realize all the great work they do because often they just soldier on along in the background of society, promoting health initiatives, making preparations for natural disasters, and vaccinating kiddos. They do so many important things, but one of the most important is disease tracking. There are certain communicable diseases that are mandated to be reported to the health department. If your patient comes in with botulism, diphtheria, E. coli, there's probably 50 of them that you have to report. Rabies, SARS, smallpox, tetanus, tuberculosis, all of that. So when you have a patient that comes in that has that, it gets reported to the health department. The health department follows up with patients and makes sure they have access to and are being compliant with treatment. They also trace exposures, informing other individuals who may have been exposed to get tested. They were contact tracing well before COVID made it a household name. In early 2018, 2 cases of hepatitis C were documented in Pierce County, Washington. Each case was investigated and found that both patients received injectable narcotics from the same nurse in December of 2017 in the ER at Good Samaritan Hospital in Puyallup.
What a weird word.
I'm pretty sure it's Puyallup.
You think?
Puyallup?
It's near Seattle.
Puyallup.
Puyallup?
Maybe.
Yeah.
That doesn't sound right, though, does it?
The nurse was Cora Weberg. They subsequently reviewed her narcotic dispensing records and found a higher rate of giving narcotics as well as several instances of delayed wasting narcotic doses, which is where you have 2 nurses sign off at one time that you disposed the extra narcotic that you didn't give to your patient. Cora admitted that she took the drugs with a plan to end her life due to a fractured relationship with her boyfriend. And she submitted to a blood test, which she was surprised to find she was positive for hepatitis C. She was fired. Subsequently, 2,600 patients who had all received an injection of some sort in the ER during the time she worked there, these are not all narcotic injections, but any IV injection, had to be notified to come in for a free Hep C test. What a nightmare. They had to have a press conference and send out letters to all the patients. This had to include all ER patients, not just the ones seen by Cora, because nurses often help each other. They work as a team. So it might not have been her specific patient, and she could have still given an IV injection to them.
No one wants to hear that. It's way worse than when you find out the lettuce you bought was recalled for E. coli. Way worse.
It's not like it's a recall on your car. It's a lot different when there's a recall on your surgery.
There's a recall on your sinuses. There's a recall on your sinuses. There's a recall on your soul.
I had surgery on my sinuses. Got a little roto-rooter situation happening. But before that, I had asked to make sure how they were cleaning their equipment. and I was told that they were doing the high-level disinfection for their scopes. And then a couple months later, after my surgery, then I got a piece of mail saying, sorry, we were not cleaning our scopes with a high-level disinfection.
Oopsie daisies.
Not okay.
That's real upsetting, especially when you ask specifically.
What made you ask that question about the disinfection?
I asked the question because I actually worked at a clinic in the same system. And when I started working there, it's a women's health clinic, and they were not doing high-level disinfection of the vaginal probes. And I had to implement that whole system to get them to begin doing that high-level disinfection for the vaginal probes. And I realized in that there was a gap in the system's monitoring of what was going on in each individual clinic.
That is disgusting.
Oh my God, it's so gross.
It was really disgusting. However, though, before there wasn't the high level disinfection, it was just like basically wiping it with a disinfection wipe using a cover. And that was the standard of care. But it's no longer the standard of care and hasn't been for 15 years or something. So
Thank God for the cover.
Thank God for the cover.
the cover doesn't do much.
I don't think most people would have known to even ask that question. So
No, most people would not ask that question. But I was furious that I did ask the question, and I was told, and I explained to them why I was asking, and I was told that they were doing the high level disinfection.
you got the yeah. We're good. Yeah, we sure do that.
You were lied to.
Very frustrating.
And they were doing a high level disinfection on the probes that they use pre-surgery, but there's different probes that they use post-surgery. And those ones they were not doing the high level disinfection on, which I don't understand. And it's post-surgery that's most important. That's when you're the most vulnerable to having an infection. You just had your whole sinuses roto-rooted and like bone scraped.
I think we just lost everyone when you said bone scraped.
Bone scraped my face.
If you suspect that your healthcare facility is not cleaning their equipment properly,
What you gonna do about it?
I don't know what you're supposed to do about it, but definitely ask.
It didn't seem to help.
If the side rail has a big bloody fingerprint on it, just go to a different hospital. Just do it.
I wish life was that easy.
I wish we had choices in healthcare.
I know, because then the insurance is like, nope, you got to stay there.
There's no medical code for had to be transferred due to blood and poop on the bed. The hospital also filed a report with the Puyallup Police Department regarding the narcotic diversion. Let's talk a little bit about hepatitis C. It's a bloodborne virus.
Boo.
It's not a good one. According to the CDC, most people become infected with hepatitis C by sharing needles, syringes, or other equipment used to prepare and inject drugs. But there are less common ways to get it. Birth is one. Approximately 6% of infants born to infected mothers will get hep C. Other healthcare exposures, a la they didn't clean my scope.
Also, hep C can live outside of the body for a lot longer. It's encapsulated. The hep C virus can live outside of the body on equipment for up to 6 weeks, according to the CDC.
I hope they still exist while you're listening to this podcast.
You can get it by having sex with an infected person, though it's not actually super common. Unregulated tattoos or body piercings.
Unregulated.
Just don't get your tattoo at a sketchy place. And if you ever go get a tattoo or piercing, you make them open the sterile package in front of you, in front of your eyes. If it is not a place where you see it open in front of your eyes, you walk out and you go to a real place. Stop it.
Stop it.
Here's the other thing. You can get it sharing personal items like glucose monitors, razors, nail clippers, toothbrushes.
Nail clippers.
Right? I mean, you're being a reckless nail clipper, right?
Aggressive nail cutting.
The person before you is aggressive and you are also aggressive if you're getting it from the nail clipper.
Correct.
Got a fucking hangnail.
It's too much. It's too much.
Butt plug.
Butt plug Doug.
You could.
Services 6 weeks.
Yeah.
Sterilize that shit.
But also toothbrushes. Wow. I mean, don't use other people's toothbrushes. I don't care if you're married. I don't care if you've been together for whatever. You're disgusting.
There's a lot of reasons.
Don't do it. Don't.
It's the year 2025. No one needs to be sharing a toothbrush.
No. Ugh, it makes me want to throw up. Oh, and blood transfusions and organ transplants. Now, before 1992, this was more common, but now we test for all that. The test is not perfect. You still have a very low risk from a blood transfusion now, but it's extremely low.
Also, with organ transplants, speaking of that, they will transplant Hep C positive livers, for example, because it's better to treat the Hep C later than dying of liver failure.
I didn't realize that.
Usually they get a choice. The transplant team will come to you and say, hey, we have a liver that matches you, but
It's got a little problem.
disclose a little issue. You get to choose. And then it's kind of like, well, am I going to live long enough to get another one that matches me? Or do I take the bum liver? It's a real hard choice.
And it's like they're not going to put like a bum liver. They're just...
Right. It's going to be functioning fine or they wouldn't transplant it.
And they'll treat the Hep C.
It's very treatable, but you have to know you have it. And so the issue with Hep C is that it can cause loss of appetite, stomach pain, nausea, jaundice, or you can have very few symptoms or just really vague symptoms.
Or just like any, it's like those symptoms that you maybe go to the doctor for and they're just like, you're fine.
Yeah. Fatigue, Well, okay. Are we not all fatigued?
I'm tired every fucking day of my life.
Right?
I wake up, I'm like, God, can I go back to bed?
Maybe you have Hep C.
Maybe.
So the problem is if you could have these vague symptoms, you just get poo-pooed along over the years, and then all of a sudden you are yellow and your eyes are yellow. Your skin is yellow. You are jaundiced. You go to the doctor and they're like, oh, there's probably something wrong with your liver. And then they test you for Hep C. By then, the damage is done. So you've got years of slow damage to your liver, but then you only figure out you have the Hep C when you have liver failure.
For a long time, I was seeing people who were Hep C and abused alcohol. Those were like, it seems like the combo of those. But maybe it was just because we worked in the ICU, but that was what we would see.
I think we have a really skewed
Viewpoint.
of Hep C because we worked with liver transplants. And so
Yeah.
a lot of them had Hep C. And so we were like, oh my God, Hep C, you're going to have to...
You definitely will die. You definitely will die if you have Hep C.
And that is not the case. And it is treatable. But even the treatment is like 2 to 3 months of daily medications, which are expensive. So it's not a small task to treat.
And it doesn't make you feel good.
No.
People don't feel well being treated.
Yeah. And when you don't feel well, you don't want to take that daily pill that's making you not feel well when you just had a vague symptom before. Medication compliance, it's difficult. Any cases found to be linked to the hospital would receive treatment for free. Thanks, hospital. I feel like that's the least you could do. You can also pass it to others while you are unaware that you have it. So while we have medications to treat Hep C now, we can only treat known infections. So this is why the work of the health department is so important. So investigators were investigating, but here's the kicker. Investigators could not establish a direct link between the nurse and the infected patients because Cora did not have enough virus present to make the comparison. Okay, so here's the deal on testing. There's 2 types of tests. There's an antibody test. A positive antibody test means you have been infected with the Hep C virus at some point in your life. Once infected, you will always have those antibodies in your blood. So this could have been 20 years ago, but you still have antibodies. If your antibody test is reactive, then they test you. They do a nucleic acid test to look for the RNA in the Hep C virus. And if that test is positive, it means that you have the virus currently circulating in your blood. So on March 19th, Cora tested positive for the antibody test, but negative for the RNA. A week later, she tested positive for the RNA, but she tested positive at a level less than the lower limit of detection. And so that was too low for viral sequencing. They were unable to do the test to see if her virus was genetically related to the virus of the patients that she had seen who were now positive with Hep C. So the patients, their strains of Hep C were related.
Yes.
So we knew they got it from the same place.
Yeah.
but Cora didn't have enough replication in her blood to be able to say it's the same, to do the test, really.
Yeah.
So she was fired, and the Board of Nursing suspended her license since she had confessed to drug diversion, but she did not confess to using the same needles as her patient or withholding pain meds from the patient. She claimed to have taken the portion that was wasted out of the sharp spin. So she's saying, I never would have used the same needle on a patient.
Or not given them their medication.
Right.
I wonder if that's true.
That's not true.
I wonder in her case if that was like, did she actually...
Yeah, because she gave people hepatitis C.
Or did she?
Couldn't be traced back to her.
Maybe she had Hep C, and maybe they had a different Hep C that they got from the hospital, and the hospital would like to pin it on her. Ooh.
If there's one thing that we have all learned from this podcast, is that hospitals will go to the end of the earth to protect their own butts.
Yep.
Mm-hmm. Reputation. We can have a Taylor Swift song about it.
And now a word from our alleged sponsors.
Do you need a mental health day, but your employer only recognizes physical illnesses? Did you get tickets to the Eras tour, but they scheduled you anyway? Try You Make Me Sick voice filter. You Make Me Sick will instantly change your healthy voice to a convincing, gravelly rasp guaranteed to melt the cold, dead heart of even your toughest supervisor. Go from,
Hi, this is Chrissy. I am not feeling well. I can't possibly come in today.
to,
Hi, this is Chrissy. I'm not feeling well. I can't possibly come in today.
You Make Me Sick voice filter from the makers of Chicken Soup for the Soul.
While being investigated, Cora took a little trip. Police arrested Cora at the U.S.-Canadian border as she headed for what was said to be a long-planned trip to Guam with her boyfriend, the one that she said she had a fractured relationship with. After she was taken into custody, her mother, Eunice, who is also a registered nurse but does not work for Good Samaritan, she had some real nice statements to make to the News Tribune newspaper.
What did Eunice say?
Eunice has a lot of denial. This is what Eunice said. She said that Cora agreed to multiple blood tests in March as investigators searched for the source of what infected the two patients at the hospital, and contended such behavior wouldn't fit the profile of someone trying to keep a secret. So she's saying, well, she gave up her blood sample. Like, you know, if she knew she had Hep C, she's not going to be like, here, take my blood. She willingly got tested more than once. And then she said, she doesn't think she has it. It's the last thing that was on her mind was that she would have something like this. She would talk to me. I would talk to her. If I had something contagious, she would do the same for me. She's not an IV drug user. She doesn't have sex for money. Eunice is judgy.
Yeah, Eunice.
You sure about all that, Eunice?
Yeah, Eunice. Yeah, I'm sure your relationship with your daughter is super close.
Yeah, she would have told me.
She would have told you, Eunice.
She said, she's in a monogamous relationship. She's smart. She's sympathetic. She's got a heart of gold, and she wouldn't hurt a bug. Eunice.
Denial is a really strong force in the universe.
Then she said, I raised her. She's a lot like me. You tell the truth, and you tell the truth if it hurts. That is Eunice's public statement to the newspaper. How about you shut up, Mom?
I feel like Eunice is not telling the truth.
I think Eunice is telling her truth. She believes it.
According to her narrative, she believes that. Yeah.
Yes.
Not my daughter. My daughter would never have sex for money.
Also, what part of hepatitis C is for money? Like,
yeah,
you can get hepatitis C just having regular sex, not sex for money. No cash needs to be exchanged.
And just because she's monogamous doesn't mean he's monogamous.
Boom. Following her arrest, Cora lost or surrendered her license in 4 states. She was licensed in Washington, Oregon, Texas, and California. She was released the next day after she got arrested, and A preliminary probable cause statement filed by the police alleged that she had intentionally contaminated medicine or another substance with her own blood, allegedly infected with hepatitis C, and administered the medication to patients. But no charges were filed. They just arrested her because she was trying to leave the country. They didn't want her to leave and flee. They obviously knew they didn't have enough for a real charge yet.
Huh. They can still arrest you without having a charge prepared? Like a judge wouldn't a judge have to sign off on that though?
Well, they had probable cause to arrest her.
Because she was trying to flee.
But they didn't have enough.
Oh, in the confession, there's that too.
To charge, right. Which you would think they could charge her for diversion, since she confessed to that.
Yeah.
But I think they wanted to have the whole kit and caboodle together. At the time of her arrest, her attorney made some statements that kind of outlined her defense. Her attorney's name is Brian Hirschman, and he said, when an officer makes an arrest but no charges are filed, that's a good indication of how strong their case really is.
Oh.
My client did not stick anyone with a needle. My client did not pass hepatitis C to anyone. In fact, we still don't know if she even has hepatitis C. Hirschman said that Cora had been scapegoated by the hospital after officials there started taking heat about patients who became infected by some other means. So he's trying to blame the hospital.
Yep. That's his job. That's his job to get his client off.
I mean, it's a pretty good defense.
It's a great defense.
Yeah. It says, what better person to blame than a person who has had possible psychological problems and purported drug problems?
I mean, that's exactly what I would do if I was the hospital. Totally.
Yeah. Her lawyer says that tests have shown that her blood is not genetically related to the infected patients confirmed for hepatitis C by the hospital. Therefore, she isn't the source of contamination. But that's not telling the whole story. It's not that she's not connected. It's that they couldn't run the test because she didn't have enough virus to do the DNA part of it. Yeah. So he's using part science, right? He's saying, well, they can't prove it, which is true. They couldn't, but it doesn't mean it didn't happen. He can't prove that it didn't happen by the blood test either.
Right. But if it comes to a jury, then it's going to be like...
That's doubt.
It's doubt.
That's totally true.
It's a reasonable doubt.
Yeah.
Reasonable.
Cora made a statement. She said, I want everyone to know that I never intentionally or unintentionally stuck anyone with a needle with which I previously stuck myself. Out of all the allegations against me, this is the most awful, and this is the allegation that I deny the most. Which I think it is the most awful allegation.
Yeah.
But it's also smart, even if you did the whole thing, to confess to part of it and being like, yeah, I did that, but I didn't do the really bad thing.
Yeah.
You could go either way. But as a nurse, I would be real offended if somebody accused me of harming my patient rather than just harming myself.
Yeah.
She also contested that she had Hep C. She stated, in fact, as of this very moment, I do not believe that I am a contagious carrier of Hep C, which is interesting wording.
Contagious carrier.
Does she just mean she doesn't have enough in her blood to be a carrier, to give it to somebody? She didn't say, I've never had Hep C. I don't have Hep C. She said, I'm not a contagious carrier. It's interesting wording.
Yeah. It seems very deliberate.
In total, 12 patients linked to the ER during the time Cora was working there tested positive for Hep C. They had the initial 2 and then 10 more were added when they did the community screening.
Whoa.
All of them were cared for by Cora, and they all have the same strain.
Oops.
There were other patients that were found to have Hep C in the hundreds of patients that were tested, but they had genetically distant strains and they weren't cared for by Cora. Is that a coincidence?
There's no coincidences in the universe.
But sometimes there are. In 2019, the CDC released a morbidity and mortality weekly report regarding Cora's situation. And this is back when the CDC was, still a reputable place. They concluded that transmission likely occurred as a result of unsafe injection practices during drug diversion by Cora. Their investigation strongly indicates that Cora was likely the source of infection, but obviously the CDC is not a court of law, and they do not have that genetic sequencing that I think you would need to actually win a case in a courtroom. The door is wide open for doubt. Wide open.
And doubt in a court of law means not guilty.
You can't prove it either way, 100%.
But didn't she also admit to it?
No, she only admitted to the drug diversion. She admits she did that.
Yeah.
She adamantly denies the sharing of needles.
Okay, yeah, that's right.
It wasn't until September 1st, 2023, 5 years later, that federal prosecutors filed a bill of information charging Cora with one count of tampering with consumer products.
That's what she finally got charged with. That's the only thing that they could make stick.
It's the only thing they have real evidence of, right? They have her confession.
Yeah. 5 years? Holy shit. I mean, yeah, COVID, but fuck, 5 years?
Right? It's weird. She also took a plea. They did a combined arraignment and plea hearing on September 5th.
Oh.
So I'm thinking her attorney probably said, let's just get this over with. We will plead to this.
Right.
In Washington, the charge carries a maximum sentence of 10 years in prison.
Whoa, that is a lot.
Yeah.
Tampering with a consumer product. That doesn't have to be narcotics.
No, it could be anything.
Could be anything.
A bag of chips.
All that in a bag of chips.
You're a tampered bag of chips.
Her lawyer made a statement. Her lawyer said, moreover, the crime to which she is entering a plea is purely a drug-based crime, since in the grips of her depression, she was diverting leftover ampules of drugs out of the disposal bin after they had been used on the patient. So he's still denying any needle sharing. 4 days after being charged, she agreed to plead guilty to the charge in the U.S. District Court. It comes with a prison sentence of up to 10 years and a maximum fine of $250,000 and up to 3 additional years of supervised release, along with as many as 5 years of probation. As part of the plea deal, she admitted to tampering with vials of hydromorphone and fentanyl. And then the patients brought a class action lawsuit against the hospital.
Yeah, I mean, what else could they do? Jeez, because they were getting screwed in the criminal court, so they'd have to go to civil court.
Yeah. They claim Multicare failed to meet the accepted standard in supervising and hiring
Okay,
Cora.
so Good Sam became Multicare. That's right.
Yes. Unless you can find that she's diverted drugs in another state, good luck proving they didn't, I don't know, maybe the supervising part, but it seems hard to...
Yeah, and that trial's still going on.
I believe it is. And she has not yet been sentenced as of recording date.
It's really curious to me. I wonder how much, looking back into the other states that she was licensed in, clearly she likely worked in those states. If there were any other issues that she had anywhere else.
Right.
Has she ever been fired? What's her history?
Yeah. Why was she leaving her jobs? Why was she leaving the state? Was she just doing travel nurse thing? I mean, I know nurses who are licensed in 10 states.
Sure.
Doesn't mean they were doing anything wrong.
No, of course not. But
if we've learned anything, it is that people state hop.
yeah, absolutely. It reminds me of a case of the surgical tech, 2015 or something like that. He was working in Colorado and another employee saw him tampering with a syringe that had fentanyl in it. And they basically watched him swap it out for a syringe that had saline. And so he was promptly fired from that job and then investigated and went on to admit that he was using syringes for himself that were used on patients. He was also HIV positive.
Was he also using his syringes on them or just their syringes on him?
I mean, I don't think he has his own personal syringes.
Which way is the contamination?
I think he was using some of the drug
And then injecting them.
and then injecting them. I don't think he was injecting at all, though, because he's a surgical tech. He's not a nurse and he's not an anesthesiologist. So he's the one setting things up. He's touching everything and laying everything out.
So he's given a little to himself.
A little for him, a little for them.
Yeah.
So come to find out, he had been fired in, I think, 3 other states and 5 other jobs.
What the heck?
It was like Washington, again, with the
Washington, California, and Colorado, I'm pretty sure, were the states he had been fired in. And nobody has ever been found to have HIV from him. But yeah, he was sentenced. He pled guilty and he was sentenced to 6.5 years, which, to me really just doesn't seem like a lot. Oh, the other part of his story too was that he was in the military in Afghanistan and he was a medic for the Navy and he was dishonorably discharged because they found him diverting fentanyl. It just blows my mind that people can just keep getting away with the same crimes over and over and over again, like dangerous crimes.
Like Catholic priests.
This can't be the first time Cora diverted, right? I mean, most likely, it could be, but most likely, is this the first time she diverted narcotics?
Likely no. It's hard to know, but who knows? So Rocky Allen is the name of the surgical tech that I'm talking about. And he was sentenced for tampering with a consumer product and obtaining controlled substance by deception.
What? Tampering with a consumer product.
It is so crazy that the crime is tampering with products and not tampering with human lives. That's so messed up.
And now, to restore your faith in nurses.
A man recently admitted to a long-term care facility was distraught about his dog Boomer ending up at the pound. When his nurse heard him in distress about his dog, she went to the pound and adopted Boomer. She was able to bring the good dog to work with her, where he was able to take wheelchair rides with his old pal.
Thanks for hanging out with us for the shift.
In lieu of a Press Ganey survey, please leave us a 5-star review.
We are at Terrible Nurses Pod on Instagram and TikTok as long as it lasts.
Email us at terriblenursespod@gmail.com.
This podcast is for entertainment purposes only.